Hello, everybody. Hi, this is Dr. Radiales from the Atlanta office. Today, I'm going to talk about some of the controversies around embryo transfers. And it's a question that I have to discuss with my patients on a regular basis. So, let's talk about transferring low grade embryos, day 7 embryos, and mosaics. Okay. Um, This varies from clinic to clinic. A lot of the clinics around us, if there is an embryo that's PGT tested and it is not 100% normal, a lot of clinics will not transfer. And then there's the controversy about, what to do with mosaics and what does that mean? And there's even controversy around whether a normal embryo is categorized as a mosaic in certain places, and a normal embryo is by potentially a different lab. So there is quite a bit of controversy around this subject. So let's talk about what does that mean. So an embryo that can be biopsied had to be biopsied past day 5, and then it gets a sample of what will become the placenta gets taken and sent to a specialized lab for those tests to be run concerning the genetic composition of the embryo. A lot of times when you do the expansion of this cell line by the new generation genetic development, then you might have a group of normal cells versus a group that seems not to be normal, and that's where the mosaic is, right? And if it's a high grade mosaic, meaning there's a lot of abnormal cells, if it's a low grade mosaic, then there's less abnormal cells, and chances of becoming a normal baby are actually higher. However, even on the high grade mosaics, you can still have a chance of self correction and that embryo becoming normal. However, there is an intrinsic risk of transferring a mosaic or even an abnormal embryo, even though that it has its own controversies by itself. And and they seem to have a higher risk of miscarriage and developmental delays or disorders. And that's something that sometimes cannot be picked during post implantation testing, such like the ones that are being done on the 11 to 13 week pregnancy via maternal blood, or even with chorionic villus sampling, because it's indirect. So then, in order to have an absolute diagnosis, it would have to be a amniocentesis at 16 weeks, and then there's other controversies around that. So there is an intrinsic risk. However, they've done studies that show that those pregnancies that come out of a mosaic transfer, there's actually less than 1% that will make it unless they are normal. So of course, the chances are small, and in most cases, the result issue, if the embryo is not going to self-correct, is actually having a miscarriage. So that's some of the controversies around mosaic transfers, and that's why some clinics opt not to transfer mosaics or abnormal embryos. And us at CNY, we have no issues with that. So because we want to see the happy end of the spectrum, meaning yes, you could have a high risk of miscarriage or other issues with the pregnancy. However, the chance is so small, and these babies, all of the low grade controversial embryos actually are shown to go 10 to 40% into live birth ratios, which brings me to the other controversy: what to do with low grade or day 7 embryos. So what is a day 7 embryo? So normally a blastocyst reaches that stage somewhere between day 5 and 6, and an embryo that took a little longer to develop to reach that stage would be a day 7 embryo. Some clinics also deter patients from transferring on day 7 or day 7 embryos because they feel that it's an embryo that has shown some impaired development and it's considered a lower grade. However, like I was mentioning earlier, a lot of babies do come out of day 7 just like they do from mosaics. So therefore, there's a lot of controversy around this. Same thing with the low grade. What is a low grade embryo? It's an embryo that's considered of less quality based on the subjective evaluation of the embryologist. So embryos are categorized as AA or BB or CC or combination of those letters. A CC embryo is actually considered poor quality, and those are the ones that I'm referring at. That does not mean that it's genetically abnormal. That just means that during the early stages of development of the embryo, while it was in the lab, it did not develop at the speed and the way that is expected for an embryo to develop. However, as part of the controversies around this subject, a lot of babies, like I mentioned before, do come from controversial embryos. And it is estimated that the clinics that do not transfer mosaics or low grade embryos actually could have a negative impact in their statistics up to 5%. So I think that's pretty significant considering that having sex in the bedroom has a success rate of 10%. The reason that people get pregnant naturally is because they have month after month of trying to be able to actually conceive, and that's besides from honestly divine intervention. When I was in medical school and I went through embryology and everything that is needed for an embryo to become a full human, from that unicellular state to a full baby, and everything that can go wrong. The more I remember those classes, the more I really believe in God. So we're here because our design is so perfect that there's no other way. So I wanted to kind of touch on this. I know that it's a big question I debate every day with my patients concerning should I transfer the abnormal? Should I transfer the mosaic? How about the low grade? What's the next step? I think that every embryo is the possibility of a pregnancy and should be given a chance. A middle ground would be to transfer higher grade embryo with a lower grade embryo, understanding that there is a small chance of twin or triplet, pregnancy if one of those embryos do split, and I've seen that happen. But it does give that embryo a chance to be in the best incubator for the embryo, that will be your body. All right, I hope that this inspires some people. You are always welcome to reach out to me if you have any specific questions or you want to discuss your case. And I will see you next time.